short repeat of the most important thing from the last lecture on one slide, that please remember that we have some distribution of somatotopic regions within two most important gyri for motion and sensation. So they are precentral and postcentral. Motor is a pre and sensoric is a post. And then you can, on those two images from Gray's anatomy, see very well how are distributed the regions for motor and also for sensoric things. Because where we have the most large number of muscles and where we are able to make precise motions, like at the region of the hand, and from the head the largest is a thumb, and also for making vocalization for the oral region, especially the lower part of the innervation of a facial nerve. So there we have the largest area on the surface of the gyri. In comparison to the others, you can remember very well that in the region of, for example, the arm, we have a relatively small number of muscles. The dorsal group on the arm is only one, triceps, and on the anterior group we have three muscles. If you compare it with the muscles, number of muscles in the region of the hand, so then it's really seen that the motion with the elbow and the arm takes a relatively small area, because they need small number of neurons for motion, rough motions in those localizations. On the opposite side is a precise movement of the fingers when you need to do something with them, to write something, to prepare something with the hands, etc. The similar is when you compare everything with the face region. If you remember those small muscles, all small muscles which are in the region around the mouth, so then we have about 25 muscles, and this region, because we have to modify our face during our mimics and also vocalization. So when we modify the sound created in the region of the larynx, so then it's important to have here multiple neurons guiding the motions. On the opposite side, on the postcentral gyrus, in sensitive region, we have some organs which are more sensitive than the others. So again, it is a face region, hand, and also foot region. So this is one important summarization from the last lecture. Now we turn to the rest of the cortical regions in a telencephalon, and also here it could be a little bit one more completion of information from last lectures. So what's very important is the limbic system. Limbic system now is recognized like a complete, complex system which covers telencephalon, diencephalon, but covers also some regions which are in a mesencephalon and in the region of reticular formation. But the part which is localized in a telencephalon is called lobus limbicus, so limbic lobe. What's limbic lobe? Limbic lobe in the region of the telencephalon covers the surface of a medial part of a hemisphere and medial part of all lobi. So it's a frontal, parietal, occipital, and temporal lobes, and then it is associated and connected with the centers which are localized in the encephalon. We know that those most important structures of the limbic system in the encephalon are mammillary body and anterior nucleus of a thalamus. This connection with the encephalon improves the connection of the functions of the limbic system which are associated with other functions of the encephalon which are able to maintain the production of hormones in endocrine system, and also they are able to make some input into the autonomous nervous system to the parasympathicus and sympathicus. What structures are in the limbic lobe? The most extent is the part which is called gyrus cinguli. Cingulum, do you know what is it, cingulum? Who knows it? You know probably how looks like monks, and they have no belt. They have something which is in the middle of their sutana, so this is a cingulum. Cingulum is like a belt which is surrounding corpus callosum, and this is a neocortical part of the limbic system. So it is a neocortex. Then we have the other parts, and we know that part of limbic system are hippocampal formation and the structures around. So it's a gyrus parahippocampalis and uncus, so those are those structures here. And then also subiculum and entorhinal region, and also dentate gyrus and some remnants of parahippocampal gyrus, which is called Taenia giacomini, which is lying here in this part. And those structures are parts which are part of a paleocortex. The structures of white matter which are important also in this region is a fimbria fornicis, and fimbria then is forming fornix. This is a fornix. And fornix is a white matter communication between all those structures of a limbic system. We know that all parts of limbic system, including the encephalon and including telencephalic part, is covered in a so-called Papez circle. This Papez circle enable to rotate and to interchange the information between all those structures. So between neocortex, between paleocortex, and between the encephalon. The circle is important for the most important function of a limbic system. What is limbic system? The limbic system is associated with rhinencephalon, and rhinencephalon, you know that it is a archaic part of central nervous system, which is in the evolution the first system which was able to create some memory imprint according to the chemical information from outside. And the olfaction, but not only olfaction, but also the sensation of a nasovomeral organ in other animals, which is a Jacobson organ, in cats, horses, also in some lizards, snakes, is a very important second analyzer of distant chemical signals. This olfaction then is very important for two things, for emotions and for breathing. The emotions are some association of the chemical signal and some memory imprint. The imprint of memory is made in the archaic systems by amygdala, and we know that amygdala is the oldest part of basal ganglia. Amygdala is localized in the temporal lobe and is very close to hippocampal formation. So the limbic system then is able to communicate with the olfaction. The system is taking information from distant environment. So the cat is smelling what is around, but cat is very advanced animal like me or you. But also this chemical analysis is originally very prominent, for example, in white shark. And white shark is able to smell in the water the blood for many kilometers. And then the primitive imprint is that when this animal is smelling blood, it is the information that this is the time for a hunt. So these primitive imprints are the base of the function of the limbic system. So it is a preparation for hunting or defense, or on the other side for the breeding. And all those emotions, all our emotions, are evolutionary, arising from those very primitive memory imprints and association with positive or negative stimulation. And then this information about smelling is then transmitted into those organs, and here we are able to perform some memory imprint, and then the information is then transmitted into the diencephalon, and from diencephalon in mammillary body to the anterior nucleus of thalamus. And then when you look at those structures, what is very close to it? Very close in midline or around the midline is the hypothalamus, and in hypothalamus, or both part of hypothalamus, lateral, left or right, we have here the production of hormones. And also, this is projection to create important hormones which are stimulating our body for hunting, defending, or breeding, which could be, for example, adrenocorticotropic hormone is then released, and then from adenohypophysis, and then is stimulated the production of glucocorticoids from the cortex, and those hormones then creating for us, for example, they are increasing the level of glucose in the blood. So you can see very primitive circle which is transmitting the information from outside and to prepare body for the proper reaction. When you will have hypertension, when you will have some other endocrine problem, and then the hypertension is the best example, then those primitive stimuli could be under the hypertension. If some people are under emotional stress, they could have increased blood pressure according to these primitive mechanisms, because they are developed 100 million years ago, but in our bodies still is working and sometimes are stimulated one part with some different stress. The stress could be the examination from the anatomy or loss of a partner. It could be everything. So this is a very primitive system, complicated system, which is transmitting external inputs to the system of the maintaining our inner environment. So the cortical parts of renencephalon are those which are localized inside the lateral ventricle and very close to it. In our brain is overgrowing the upper part, so parietal frontal lobes. In temporal lobe is something which is very well developed in the whole ventricle or around the whole ventricle, for example in lizards, or snakes. But we have here the important structure which is called hippocampus, and the hippocampus is made from hippocampal gray matter. Very close to it is dentate gyrus. Hippocampus has inside white matter the gray matter, which is called cornua monis, and then is the inner part is lying in ventricle, and we know that then is following by subiculum, and a subiculum is a cortical part which is lying facing to the subarachnoidal space. So those are the most important things which we need for temporal imprints of the memory and then the creation of some long-term memory. So when those structures are impaired, typically in some diseases like in Alzheimer's disease, those patients could have the problems to fix memory. They have an imprint from very, very long-term events, but they are not able to remember what was this time, half hour, 2 hours before. So then, this is one part which is here, and then the other association cortices is a subiculum and entorhinal cortices. And also those structures are cortical parts of projection of olfaction. So then, really, limbic system is very, very close to the olfactory system, and then we can explain the function really in the primitive, in the base principle, like the memories which are made in our central nervous system according to the stimulation from outside. So, renencephalon olfactory brain is a continuation of nervus olfactorius or associated structures. So, olfactory nerve has a bulb, and then it is following by the tractus olfactorius. In olfactory tract, in the middle about, is interesting structure which is called nucleus olfactorius anterior. There are some interneurons which are relate the information of olfaction into the cortex. Then is associated with paleocortical structures which are, when we look here on this image, this is from the base, so this is a mesencephalon here, this is a mammillary body, infundibulum, this is a chiasma opticum, and here we have two lines of information flow. One is medially, it's a medial olfactory stria, and lateral olfactory stria. The lateral olfactory stria is then streaming the information into the primary cortex, which is a primary projection of olfaction, of real olfaction. And then we have other olfactory parts, which are those. So this is the uncus, and this surface of temporal lobe is called also cortical amygdala, so cortical projection of amygdala which is inside, and parahippocampal gyrus where is entorhinal cortex. So paleocortex is something which is association cortex for the olfaction. Like we have association cortex for auditory and visual system. Very interesting and important are structures which are lying at the tip of the primitive neural tube. This is a septum verum. And a septum verum is localized somewhere here over the crossing part of optic pathway. And probably you have remembered that there is a space where we have organum vasculosum, and then also they are nuclei of hypothalamus where are secreted vasopressin and oxytocin. So then again here is the direct line from olfactory system into the system which maintains the inner environment. So what inner environment? Hormonal, and also there is some inputs for intake of water, for example, the proper setting of a blood pressure, etc., etc. So now we turn to real olfactory organ. Organum olfactus is in the reality in a upper part of a nasal cavity. The upper part of nasal cavity, the cranial 1/3, is called regio olfactoria, olfactory region. It takes about 4 to 6 square centimeters, so it is a quite small surface. In other animals where the olfaction is the leading sense, we have our leading sense is a vision. Then hearing and the olfaction is not too important in our species. But for example, wolf or fox, also cat, they have a larger surface and more cells. So the real sensoric cells are bipolar neurons. The most primitive neurons which we have in our human body are those used for olfaction. They have dendrites which are like phyla olfactoria localized like receptors in the nasal cavity. Then they are passing the cribriform lamella of ethmoid bone, and the axonal part, the basal part, is then transmitted information into the bulb. There are some primitive networks between those neurons. So also here is a primitive association system of a nervous system. So also olfaction is in reality the part of a central nervous system. So from bulb, bulbus olfactorius, then it is transmitted information into the central nervous system. Rudimentary system in our body, in our head, is something which is called organum vomeronasale Jacobsoni, so Jacobson organ, which is connected to the zero cranial nerve called terminal nerve. This terminal nerve is well developed in those animals using this organ, like horses, like snakes. Snakes are, I think, the most popular because they take the information from the air by the tongue, and the tongue is then waving the air into the palate, where is the ending of this organ. I have said to you that in current time, 5-10 years ago, also some authors found some important functions in human, but this is a really, I think, not too much developed in our body, but they found some functions of it. So, organum olfactus, so the structure of this primitive sensoric organ, the most primitive, is a bipolar cell. The bipolar cell has some hairy structures which are called olfactory vesiculas. They are prominent into the air content of the upper part of the nasal cavity, and the bipolar neuron has a nucleus and a body in the olfactory mucosa, which is made then also by sustentacular cells. And the information which is made by chemical reaction here, the chemical reaction creates some electric potential, which is transmitted by the bipolar neuron to the synapses, and the synapses, which is seen here, is localized in so-called olfactory glomerulus. The olfactory glomerulus is a connection between mitral and bipolar olfactory cell, and here between them are also some periglomerular cells, and also between mitral cells some granular cells. So those interneurons are able to modify the sensation and the transmission of the information from nasal cavity into the central nervous system. So this is the reason when you use perfume, you can smell it for 10 minutes, and then you yourself are not able to smell it, but your partner is able to smell it. Why? Because the inhibition of the system inhibiting something which is general in the environment. So this is the primitive neuronal network which is able to suppress. The main function is suppression of this information. Why? Because when you are in danger and you are smelling something horrible, then the suppression to smell the danger, to overcome this dangerous situation. So this is the function. So then the information is then going into the olfactory tract, and this information is transmitted by the mitral cells, by their axons. So olfactory tract is then conducting the information into the olfactory brain, splitting in two ways. I have said into the septum verum. From septum verum, we have also band, or from the region of septum verum, here is band, which is called diagonal band of Brocka, and this diagonal band of Brocka is a communication between the septal region and the region of parahippocampal localization. So this is a backwards, again, the circular flow of information from this septal area, which is important for intake of water and primitive reaction to the situation. So the cortical areas, they are area perforata anterior, uncus of hippocampal gyrus, prepiriform cortex, which is the main area where is a primer cortical region, and the association entorhinal cortex, and then also amygdala, which is able to make the memory imprint. What's important, it's only one sensoric pathway, where is no relay in thalamus. Even the information is due to Pape's circle, again conducted into the anterior part of thalamus in anterior nucleus, but is not relayed like the other, like the information from tactile, like the information from proprioception, and we will see now also visual and auditory pathways which are also relayed in thalamus some way. So this is olfaction. Quite, I think, easy from one point of view, from the limbic system not too much easy. The second thing is a visual system. We have the specialized organ which is made for analysis of electromagnetic waves, which are called light. This is the eyeball. The eyeball is a double spheres together with different perimeter, 12 millimeter sclera, cornea 8 millimeters. So then we have some optic media, through them the light is going to fall to the photosensitive layer. The photosensitive layer is localized inside the eyeball. The line where the idle perception of the light is called linea visus. Linea visus is going by the idle situation through the anterior pole, through the anterior and posterior pole of the lens, and then is crossing the whole eyeball through the vitreal body and falling into the region which is called macula lutea. So this is a macula lutea. What is the name of this? This is macula. Ceca or alba, so blind or white spot. And this is a yellow spot. So the layer which is responsible for detection of the light is lying inside the eyeball, and it is the first layer from inside facing the vitreal body. So vitreal body is gelatinous, ideally translucent, and the layer which is sensitive for light is called tunica interna bulbi. Internal tunica, internal layer, called retina. Retina has several parts. The largest one is called pars optica. And then we have also pars ceca. Also pars, which is called ciliaris and iridica. What means this? The optic part is part where is able the light create the electric signal which is registered light visual information. Because we have in the eyeball some localizations where the light is not able to be distributed, because if we have some aperture which is called iris, so then the light is able to irradiate only one part of retina. So retina is a part which is sensitive for the light, but the light has to go through the other optic media. The media are cornea, you know it, camera anterior, anterior chamber is situated here, where is liquor aquosus. The iris is blending the light. Then we have a posterior chamber, and also here is a humor aquosus. And then we have a lens. The last part, which is optic, is the vitreal body. When the light is coming into the eyeball, then is passing through all optic media, and the light is then coming into the corpus vitreum. And what's important, the light or the rays of light from the object which should be visualized has to fall directly to the retina. To the retina, we focus the light using structures which are part of uvea. Uvea is the structure which is called tunica vasculosa, so vascular layer. Vascular layer has parts which is choroidea, then corpus ciliare, and the last one is iris. So iris is focusing the light. The ciliary body, due to tendinous structures, are able to release those tendinous fibers or make it tense, and then they change the shape of the lens, and then the light is falling into the proper situation, into the proper part of a proper part of the retina. So lens oculi is again gelatinous structure which has its shape, and the shape is changed by the traction by the ciliary body, and those zonula are under tension or they are released, and then is changed the anteroposterior diameter of the lens, but also this one, and it is changing the number of dioptries of this, and then it's focusing the light to the retina. So lens has a very complicated structure. The fibers are in several orientations to making it flexible. It's very similar to the ball for American football. So it's not spheric, and the changes of the diameters make changes of the dioptria, so then changes the focusing of the light. So then the light is properly falling at the retina. So here is a retina. This is the inner, and this is the outer layer. Retina has a very specific structure, and here in inner we have a vitreal body, and here we have uvea. The line between uvea and retina is made by the single layer of melanocytes. So melanocytes are cells containing melanin, and this melanin is very important because it is able to reflect the light and to improve the photodetection by the photoreceptors. But there is also a very important danger. Those melanocytes could be also the origin of the tumor. In the future you will hear about the ocular melanoblastoma, or also called uveal melanoblastoma, which is occurring here. So it's a very malignant tumor, similar to skin melanoma, but behaving by a little bit different way, but also very danger tumor, which is relatively common in population. Not too much like skin melanoma, but for example, in last 3 years, we have here about 40 patients assessed in our Department of Nuclear Medicine on PET-MR for this tumor. So it's a relatively frequent tumor. So this is a melanocytic layer. So then we have several layers. In general, important is that the photosensitive, and remember, photosensitive cells are in the outer line, in the outer layer of the eyeball, more distant to the light ray. So, when we go from inner to outer, the first layer is typically made by fibers, And those are fibers which are collecting the information and going into the optic nerve. So it is going to the second cranial nerve. Then we have a layer which is called ganglional or ganglional layer. There are ganglional cells or ganglional cell bodies. They taking information from interneurons, and then we have internal plexiform layer. There are synapses between interneuron and ganglion cell. The bipolar neuron, interneuron, then is connected the own photoreceptors with ganglional cells. They have, so these interneurons are in inner nuclear layer. There are nuclei on bodies of those interneurons. Then we have outer plexiform layer. Outer plexiform layer is the synapses between interneurons and the photoreceptors. The photoreceptors, they have their bodies and nuclei in outer nuclear layer. And the most outer layer is a layer where are photoreceptors in inner receptor layer. The receptor layer is a part of cells which are called cones and rods, and they are in a hairy processes of the melanocytes. So those are those layers. What's the creation of the information? Where and how the electric potential is going? So we have two kinds of photoreceptors. We have small rods, and rods are more and more than cones. So also on this image, this is a cone and it is a rod. The rods are equipped with rhodopsin, and cones by iodopsin. Those are almost only black and white, so in gray levels, and they are for color. And we have three kinds, three pigments, three sensitive iodopsins for three extents of frequency of the light. So then we have rods and cones. Rods are more sensitive in the dark than cones, and cones are more sensitive in the full light. So you can observe if you are going in the time between light and night, so you see everything not to color, so more gray than color. Also, the hunters like cats have more developed this visual system of roads, and they sometimes are not able to see the color. For example, jaguar in Amazonia has only black and white vision, so then some animals are very crazy in their colors because they have the same frequency of the light in the black and white like a green. So they are masked in the eyes of a hunter which have black and white. So this is the reason why we have not too much developed our spatial recognition in the dark because we don't use cones. The second important thing is that the information which is created here in a photoreceptor is then transmitted through the body and to the relay of the rod and here cone. Here is important that typically from cone we have minimal way to one ganglion cell, and from ganglion cell the discrete information of a space is transmitted into the brain. So from one cone is made one stimulus. But from rods, they are multiple. Sometimes tens, sometimes hundreds of rods have convergation of a signal into the one ganglion cell. So then is the reason why the visual input from rods is not too much sharp like from the cones. So please remember, in general we can say from one rod we have one bipolar neuron, and this bipolar neuron is transmitted through the ganglion cell the discrete information. But from multiple rods takes information one ganglion cell. So those ganglia could be very similar to ganglia which we know from the other sensoric systems like spinal ganglion, like trigeminal ganglion, etc. So the ganglion here is lying directly in the layer of retina. So then also probably you remember that retina is a part of a central nervous system, not peripheral. So please remember that we have rods and cones, and there we have several layers. Those layers are called according to the function. So the signal is created in photoreceptor line, then we have a line where are nuclei of the photoreceptors, first relay, the second relay is skipping the layer of bodies of the bipolar neurons, so the second inner plexiform layer is another synaptic thing, and then ganglionar layer where the information then is conducted into the optic nerve. So another optic pathway. Optic pathway is very, very important for the clinical examinations. Clinical examinations, one of the first things is when you go to the patient, if he or she is able to see everything, you can change the visual inputs to cover one eye or second eye, and also to look at the lateral part of the visual space, etc. But we have also some specialized assessment of the visual visual sensations. But what is important? We can distinguish something which is called visual field. For me, I have a left and right visual field. And because of very easy optic geometry, the visual field is tan. When we have lateral visual field, left lateral visual field, so one eyeball is using the nasal part and the second is using temporal. And we use those two parts for the visual sensations from one field. Then remember that the information from visual field is transmitted to the contralateral cortex. So it's like in a hands, but it is a visual field. You have to remember that visual field is a contralateral and both two bands, both these informations are then conducted the same way. So one half of fibers is crossing in the region of optic chiasma. The optic chiasma is taking the band of contralateral eyeball from the visual field, from the same side visual or the temporal is not crossing. So this is important. Then in a chiasma are crossing which informations? Informations from nasal parts of retina. So then, when you have the problem here, when you have here, what could be here? I have said to you that there is a very clear association with some space-occupying lesion localized in a thoracic cella, typically macroadenoma of pituitary gland, could cause the injury of this chiasma. And the patient has then loss of vision where? From here and from here. And this is called bitemporal hemianopsia. So we have visual fields, temporal bone, and nasal. So each eye has a temporal and nasal part, and temporal and nasal visual field. Temporal visual field is using nasal part of the retina. It's a clear because there's a simple geometric thing. So this is the one very important thing. So then, this is a optic nerve. Here we have chiasma. We know that it is in the front of the encephalon, above infundibulum and stalk of the pituitary gland. And then the optic tract is going around the diencephalon. And still here we have an axon of ganglional cell. And relay is in lateral geniculate nucleus. Lateral geniculate nucleus is relaying the optic information. So here is the third neuron of the optic pathway. The first was interneuron, the second is ganglional cell, and the third is localized here, and then is transmitted the information by the structure which is in the temporoccipital region. It's a white matter band and it's called optic radiation. The geniculate lateral body is a part of which structure? Yes, yeah, it's a dorsal part of thalamus, very close to medial one, which is associated with the auditory pathway. So then, the distribution of the signal in the optic area. Optic area is localized in occipital lobe at the polar region and along the sulcus, which is called calcarinus. Calcarine sulcus is dividing the visual field to two regions. And also here, it's a vice versa projection. The upper part of visual field is then projected to the lower part of the calcarine. And then also it's important that we have a macular, the most sharp, most intense used part of retina, and this is projected to the polar region and is localized in Broadman area 17-18. So this is important cortical visual field. Then we could have blindness, which is caused by the injury of the cortical region. So when we can compare the loss of the vision, then we can distinguish from the symptoms from the region what is not seen, to distinguish this disruption. What is here problem? Here is a problem that this eye, when the patient has injury of the optic nerve, the whole eyeball is not sufficient. Then we have no information from nasal and temporal part of visual field from the left part. So it's not complete blindness because everything could be overcame by the contralateral the eyeball, but there is no stereoscopic view. Then we have bitemporal loss of visual. Then what we have? Something which is from the optic tract to the cortical visual field. So then we have completely loss of left or right visual field. So then according to those clinical symptoms, you can from clinical point of view to distinguish where is the lesion localized. The most important is to distinguish really cortical blindness and the blindness caused by the eyeball or other things. So, optic pathway. This optic pathway then is, first is rod and cone. Cone or rod is creating the electric potential. First, interneuron transmit the information to ganglional cell, and then through the optic nerve, chiasma opticus and tractus opticus, the axon is then related to the neuron in lateral geniculate body. And through the optic radiation, the axon of the third neuron then takes fourth cortical neuron. So, and here on this image, you can trace the field and trace where is the region of the sharpest visual field. So then it's a nice schema for you to see it, how the information from the eyeball is entering the cortical region. So it is a visual system. The third is auditory system. The auditory system has also some mechanic parts, some neural parts. The mechanic parts are called outer, middle, and inner ear. And in the inner ear is the perception of the sound. Perception of the mechanic waves. So this is a third exteroreception. First was chemical input in the olfaction. The second, electromagnetic waves, visual, and here it is a mechanic waves, acoustic. So acoustic waves could be registered also in the air, also in the fluid. The mechanic waves are concentrated by external ear, by the auricle, and they are enter external auditory channel. Then we have a membrana tympani drum, which is mechanically changed, and these mechanical waves are transmitted by the ossicles through the middle ear into the osseous labyrinth. And inside the osseous labyrinth, there are two spaces occupied by the fluid. So, the first environment is the air. The second, in the middle ear, is air again. And in inner ear, it's a fluid. So remember that in the middle ear is the air because it is connected with pharynx by pharyngotympanic tube. And the proper function of the ear is caused by the air environment in the middle ear. When it is not, where it's filled by the fluid during the inflammation, bleeding, etc., the sensation of the sound is different because the behavior of this system is not working well. So, from meatus acousticus internus, external channel, the drum, membrana tympani is vibrating, and then we have a malleus, hammer, incus, and here stapes. The malleus is is connected with membrana tympani, and those three ossicles are connected with two synovial joints. The joint between stapes and incus is the smallest joint in a human body, but it is synovial, small synovial joint. Through the foramen ovale, oval window, the vibration is then transmitted into the fluid environment. The fluid environment in inner ear, which is outside, is called perilymph. Perilymph is then moving by the vibrations and transmitting vibration by the vibrations of oval fenestra or oval window or vestibular window, and then is changing the state of the fluid, which is localized in membranous system. Membranous labyrinth is the inner environment, and in this inner environment we will change the mechanic stimuli to the electric stimuli by the chemical reactions in the sensitive cells. The inner environment is filled by endolymph, and the endolymph is filling, and for us it's important for auditory and vestibular system that we have three together perpendicular semicircular channels equipped with three vesicular ampullar paths, which are called ampullae. Then we have two larger spaces, utriculus and sacculus. Utriculus is longer, sacculus is more spheric, not spheric but more spheric. And the last space is cochlea and cochlear duct, ductus cochlearis. So in ductus semicircularis, ductus cochlearis, utriculus and sacculus. In all those structures we have sensitive cells for a mechanic deformation. So what structures are used for? So this system, so semicircular channels, is rotational, acceleration, the utricular and saccular path is a linear acceleration, and here in cochlea this is sound. So for auditory system, real audition, so we use only cochlea. The other parts, which are developed on the same level of the evolution, we also are able to take information from mechanical deformation of cells, but it is not caused by the external inputs. This is from the rotational flow and linear flow of the endolymph caused by the changes of position of the not only body but also head. So, the sensations in cochlea are from the space which is in the middle. In cochlea is a spiral-like or helical-like, it's not true helix. From geometrical point of view, we have a scala vestibuli and scala tympani, where is a perilymph. And in the middle is a scala media, and inside is endolymph. So the principle is that the sound waves, according to the frequency, are able to resonate in some part of the cochlea according to the real frequency of wavelengths. It's vice versa. And then it is a vibrating apart and resonating sound here is creating the signal in this organ. From this organ, and we will have the detailed description, the signal is then conducted into the ganglion, which is not single, but it is a chain of a small ganglia forming the spiral-like structure, and it's called spiral ganglion. There is relayed the information, and then it is going outside to the cochlear nerve, which is one part of the vestibulocochlear nerve. Please remember that we have a ganglion spirale when we had cranial nerves. Then we have also ganglia, which are used for the vestibular system, where are 5 small ganglia. For each ampulla, for sacculus and utriculus, but they are close together like the onion and then forming the vestibular ganglion. The sensation from vestibular apparatus, so from labyrinthus vestibularis, are registered by 2 kinds of receptors, which are very similar. And when we will see also receptors which are in the cochlear apparatus, in the principle they are the same. They have body and they have also cilia. The cilia are different in different cells, but they have the same function. The motion of cilia making the electric potential, better it will be negative, potential inside the cell, and then it is transmitted into the synaptic system of this calyx or afferent nerve endings, and in static maculae, utriculus and sacculus, the hair cells, they have stereocilia, one long and smaller, and they are in the flat layer of gelatinous glycoprotein substance, in which are distributed, not dissolved, but distributed small crystals of calcium carbonate. So CaCO3. And according to the different motions, according to the changing of the position, this linear acceleration is then creating potential, and then the potential is then conducted by the neurons, which are connected to those sensitive cells. In semicircular channel in ampulla, there are a prominent hill on which are several cells, and those cells are equipped with one long cilia. And the gelatinous cupula, you can see how it looks like, is not equipped by crystals. When the fluid in a semicircular channel is circulating, the cupula is changing the position, and then it's creating the electric potential in a cell, and then it's transmitted by the to the nerve fiber, and nerve fiber is taking the information. So then, this is a linear, and when you can imagine that when we have such a structure of a semicircular channel, and here is a cupula, and when the flow is in one plane, and when we have three perpendicular planes with three perpendicular sensitive cupulas, so then we have the information which could be added together for 3D rotational acceleration. Cochlear labyrinth has a quite similar structure. It's equipped also by some resonator, some mechanical receptor. The mechanical receptor or substance taking mechanical changes like cupula or this gelatinous statolith. There is this gelatinous substance. There's a flat structure which is covering the organ of Corti. Corti organ, also called spiral Corti organ, has sensitive ion sense cells, supporting cells, and then also connection with neurons. In scala media, there is a endolymph, and when is resonating this part and resonating this gelatinous substance, the mechanical stimuli are transmitted to the hairy cells of this Corti organ. The Corti organ has more cilia, 40 to 50 in 3 to 4 rows. Hairy cells are inner and outer, in outer layer. Between them is a tunnel of Corti, and above them is a cell-less gelatinous or fibrous tectorial membrane which is resonating. What's important also here, very similar to the olfactory system, there are also some other synapses, and those synapses are able to inhibit the transmission, so they are gain points, because when the inhibition of the sound is made, then the information from the organ of Corti is not transmitted into the neural system. Probably you can hear here air condition when you are concentrated to it. But when you are hearing me, you don't register them. So this is also one way of the adaptation to the sound. When you are going to the Metallica concert, you are hearing them, but when you are going outside and when it's closed, you don't hear anything. So this is the adaptation which is partially made by those inhibitory neurons. So the cochlear organ then is importantly sensitive for several frequencies. So then the proper frequency resonating in some part of the helix, and then we have also tonotopic organization. So then we are able also to discriminate tones. The information from cochlea then is splitted in cochlear nuclei and transmitted through the brain, and then please remember that the information from one ear is distributed to both cortical primer auditory regions. So, about the tonotopic localization. So the transmission of a sound, you can see here high frequency. High frequency is then transmitted to the high amplitude, and high amplitude then is changing the position of the membrane in the proximal part of the helix. And then here, high frequency is going this way. On the other side, when we have a slower frequency, the slow frequency makes slower amplitude, and the most amplitude is distal. So then the information is from distal. And because of the architecture of the spiral ganglia, we then are able to detect those frequencies when they are low or high. We know that we have a 0.2 to 20 kilohertz. Yeah. Sensitivity. Other animals could have different. For example, bats, dolphins. They have a very high frequency sensations, and on the other side, which mammal has very good sensations of a low frequency sounds, you know? I don't know here. Whales, yes, whales, large whales, like a porkak, for example, and from the terrestrial mammals, it's an elephant. So they are able to hear also those very low frequency, because those very low frequency could be heard for hundreds of kilometers in the water, and for example 20 kilometers in the air. Auditory pathway in the central nervous system is very complicated. For me, my colleagues will be important to know that we have 4 vestibular ganglia for sensations of vestibular information, for balance, and they are connected to the system of cerebellum, especially, and also inferior oliva. And they are then connected to the motor system by the vestibular spinal tract, because they are able to maintain the postural contraction of postural muscles, so to balance the body position. So this is quite easy. The auditory pathway is more complicated. Then it's important to know that we have 2 cochlear nuclei, and then the next step, they are nuclei which are localized in colliculi inferiores. The 3rd level is geniculate medial body, and the 4th level is a cortical region. So this very complicated schema for me is important. We have a hairy cell, then we have a neuron of ganglion spirale, from which the information is then transmitted to cochlear nuclei. But here on this level, we have a first cross of the information. The crossing information is on the level of the oblongate. Then, through the superior olivary nucleus and nucleus lemnisci lateralis, so not too important interlace, this is transmitted information here to the colliculus. Where is relate? Here is important addition in tectum with the visual information, because for us it's important the integration of visual and auditory informations. I now hear the sound and my eyes have to fix the point. It is something or nothing. So then, here is relate again the information, but here we have the second cross. So one cross is at the level of the bulb. The second cross is at the level of mesencephalon. And then through the, or mesencephalo-diencephalon, through the geniculate body, medial geniculate body, the information is transmitted to the cortex. To the cortical region, to the Heschel gyrus. And here we have a 3rd crossing. And the 3rd crossing is a cortical crossing. And cortical relay is through the corpus callosum. So then the 3rd cross is in corpus callosum. What is important here? When we have a lesion of the eyeball, of the optic nerve, of optic radiation, of the cortex, we have distinct lesion of visual field. Somewhere we can see the lesion, and it is not compensated by the eye completely. But when we have lesion of the auditory cortex, when we lesion of the one cortical visual field, so then we have a blindness of the whole one field. When we have lesion of a cortical, auditory, primary cortex. So then the patient is able to hear the sound. Very frequently is able also to hear the sound difference, because those crossings are also used for calculating the time difference of a signal, because the sound has its velocity. But the patient is able to hear, even if he or she is losing completely the temporal lobe. The one situation when the patient has a cortical deafness is only when the patient is with the lesions of bilateral primary cortex. So this is called cortical deafness. And then the patient is not able to hear anything, and because frequently is occurring suddenly in 1 second, according to the ischemia, for example, we had a patient 15 years ago with 2 ischemias, 14 days, one after second. So then the patient in 1 second lost completely hearing, and it was a very horrible situation because the patient was like with acute psychosis. Yeah, because he was not able to hear anything. So this is important. Please remember that for blindness of one eye, we should have the lesion of one part, but the compensation of both sides is made by the 3 crossing of the information in the auditory pathway. So the auditory pathway then, in a summary, has relay at the level of medulla, then it has imported inputs into the olivary structure, and then also to the cerebellum. Then we have here one crossing at the level of a brainstem. It's partially relayed in the superior olivary nucleus. The most important relay is a inferior colliculus. Then it is relayed in a geniculate lateral body and then transmitted into the central nervous system. This is a real pathway. Body information is crossing also at this level and through the corpus callosum on the cortical layer. So, and the last slide. Gustus, taste, chuť. So the chemical analysis is made by the stomodeal part and also pharyngeal part of our gastrointestinal tract, and we are able to taste according to the specialized cells which are in papillae, in papillary structures which are filiform, fungiform, circumvallate, foliate. So filiform are here, fungiform are those larger ones, you know them, circumvallate, and here also foliate. The tongue is divided into the apical part and radix. Radix and apical part is splitted by the V-shape sulcus terminalis. In the middle is foramen cecum. Then we have here fossa palatina, and this is epiglottis. The taste is typically distributed through the tongue, but the additional sensations are also from the palate, from the pharynx, from the part of fossa palatina, and from the part of the orifice of the larynx. So gustus, taste, is then transmitted through the three cranial nerves. Three cranial nerves are facial nerve, seventh. Seventh takes information from apical 2/3 part, and the information is led through the chorda tympani. But please remember that the first segment of the nervous structure through them the fibers are led is called nervus. Which nerve is the first part leading those fibers to chorda tympani? It's nervus lingualis. Lingual nerve is a part of a fifth nerve. It's a sensitive nerve, somatosensitive nerve for the apical 2/3. In the same nerve are fibers for taste, which are then going outside from the trigemic nerve to the chorda tympani, and there is associated also with the fibers of preganglionic fibers of parasympathicus for salivary glands. Then it is entering, when we go upwards, the middle ear, crossing middle ear, entering the petrous bone, and then it is joined with the main facial nerve. Then the information is going to gustatory part of a nucleus solitarius. From a basal third, for the basal third of the tongue, the taste information is taken by the glossopharyngeal nerve and then is led by glossopharyngeal nerve by the same way into the gustatory nucleus, part of solitarius nucleus. And from epiglottis and laryngeal adytus, the same information of a taste is led by 10th nerve, by vagal nerve. So the information is led by three different nerves, in reality by the fourth nerve, which is only a highway for it. So it's a lingual, a branch of mandibular, and a branch of trigeminal nerve. And those informations are relayed in ganglia. Those ganglia where are relayed are ganglia of vagal nerve and glossopharyngeal nerve in localization of jugular foramen, and then in geniculate ganglion of a facial nerve. So this is taste. So, have you any questions about it or something else?